If you're waking up 2 to 3 times every night and feeling exhausted in the morning, what I'm about to share could completely transform your sleep, starting tonight. Hello, I get so many questions from patients about why they can't sleep well, even though they've tried everything. And the truth is, there are 7 simple tips that almost nobody tells seniors, not even your family doctor, because they're so simple they get overlooked. I'm Dr. Emily Carter, a sleep specialist who has worked with over 10,000 patients throughout my career. And in today's video, I'm going to share these 7 tips in order from easy to most important, especially the last one that 80% of my patients didn't know until I pointed it out. If you want more sleep tips for seniors, subscribe to the channel and turn on notifications right now. So let's start with the first tip you can do in just 60 seconds. Did you know that eye strain can actually prevent your brain from shifting into rest mode? This is something I see all the time with my older patients. Many seniors hold a lot of tension and stress in and around their temples and eyes, especially those with poor vision or who wear glasses. And with more and more older adults spending time on phones and computer screens, this eye strain creates a real challenge when you're trying to wind down before bed. Here's what I want you to do. It's called palming or cupping, and it takes just 1 minute. First, rub both of your hands together to get them a little bit warm, because that heat is going to help relax the muscles around your face. Then, place the palms of your hands over your open eyes. Now, you're not pushing directly into your eyes. You're applying gentle pressure around the eye sockets while keeping your eyes open underneath. Feel that warmth and darkness you've created. This is going to help activate your parasympathetic nervous system, which is your body's rest and digest mode. Keep your shoulders and neck relaxed while you do this. I recommend doing this for about a minute while you're lying in bed getting ready for sleep. After that, gently massage around your eye sockets using 3 fingers on each hand, slowly rotating them in circles as you work all the way around your eyes. Nothing too intense with the pressure. Just keep it nice and easy. This helps improve blood flow and loosens those tightened muscles, which further relaxes you before bed. Let me share a quick example. Margaret, a 68-year-old retired teacher, used to get headaches every evening. After doing this exercise every night for just 2 weeks, she told me the headaches not only decreased, but she was falling asleep 15 minutes faster. 1 minute of your time, that's all it takes. Now, if you want to enhance this eye relaxation even further, the second tip will help you do exactly that. This is a technique that many Japanese hospitals use for their older patients, and it's completely free. Using a warm compress on your eyes helps reduce eye strain while improving blood circulation and hydration in that delicate area around your eyes. Here's the simplest way to do it. Take a clean washcloth, soak it in warm water, not too hot, just comfortably warm to the touch. Wring out the excess water and gently place it over your closed eyes. You can do this for 3 to 5 minutes while lying in bed or during your wind-down hour before sleep. Just don't do it longer than about 10 minutes. If you want something more convenient, there are heated eye masks you can buy online that you warm up in the microwave. I personally recommend avoiding anything that sits too heavy directly on your eyelids. Look for ones with pressure-free eye cups. A study published in the Journal of Clinical Ophthalmology found that warm compresses improved sleep quality in 73% of older adults who had dry eye symptoms. That's a significant number for such a simple technique. You can do this right before bed, even while you're already lying down. But don't forget about this next important area of your body. I know this might sound strange, but cold feet could be the reason it's taking you 30 minutes or more to fall asleep. Let me explain why this happens more as we age. As we get older, several changes occur in our bodies. Blood circulation decreases, the fat layer under our skin gets thinner, and our metabolism slows down, which means our body produces less internal heat. This is why many seniors struggle with cold hands and feet, especially at night. Here's what happens when your feet are warm. Warm feet trigger something called vasodilation. That's the expansion of your blood vessels. This improves circulation throughout your body and helps regulate your core body temperature. Now you might be thinking, but don't we need to be cool to sleep well? Yes, but here's the key. Your body needs to lower its core temperature slightly to signal to your brain that it's time to sleep. Warm feet actually help this process by improving circulation and preventing sudden temperature drops that can disrupt your sleep during the night. The simple solution? Wear breathable cotton socks to bed. If you really don't like the feeling of wearing socks while sleeping, you have alternatives. Try soaking your feet in warm water for about 10 minutes before bed, or use a heating pad on low for a few minutes. Let me tell you about Robert, a 71-year-old retired engineer who constantly complained about difficulty falling asleep. When I asked about his feet, he mentioned they were always cold at night. After just 3 nights of wearing socks to bed, he called me with great news. I slept for 7 hours straight, the first time in 2 years, all because of a simple pair of cotton socks. If this tip is helpful for you, please hit that like button so I know. Now, let's talk about sleep position, because this is something 90% of my patients are doing wrong. The wrong sleep position doesn't just cause neck pain, it can also increase acid reflux and even affect your cardiovascular health. Let me break down the best positions for seniors. First, sleeping on your back is ideal for most people. This position provides natural support for your spine, distributes your body weight evenly across your skeletal frame, and reduces those excessive pressure points that can cause pain. Back sleeping helps reduce strain on your neck, which is extremely common as we age. However, I need to mention that if you snore heavily or have sleep apnea, back sleeping might not be your best option. Talk to your doctor about that. The second best position is sleeping on your left side. Here's why this matters. When you sleep on your left side, it helps your digestion because food moves more easily through your intestines due to the natural positioning of your digestive organs. If you suffer from acid reflux or heartburn, positioning yourself on your left side keeps your stomach acid below your esophagus, which can significantly reduce those uncomfortable symptoms during the night. There's also a cardiovascular benefit. Sleeping on your left side improves blood flow to your heart because there's less compression on your vena cava, which is your heart's largest vein. A study in the Journal of Clinical Gastroenterology found that left-side sleeping reduced acid reflux episodes by 25% compared to right-side sleeping. Now, I'm not saying you need to maintain these positions perfectly all night long. That's nearly impossible. But the longer and more often you can sleep in these positions, the better your overall sleep quality and health outcomes will be. Try sleeping on your back or your left side tonight, and pay attention to how you feel in the morning. But if you're someone who takes regular afternoon naps, the next tip is absolutely critical. Many seniors think that taking a 2-hour nap will help make up for poor nighttime sleep. But in reality, this habit is actually destroying your to sleep well at night. Let me explain what's happening. When you nap for longer than 45 minutes, you're reducing something called your sleep drive. Sleep drive is your body's natural pressure to sleep that builds up throughout the day. It's like a battery that needs to drain during the day so it can recharge properly at night. Long naps discharge this battery, making it much harder to fall asleep when bedtime comes around. There's another problem with long naps. When you're napping for extended periods, you're probably moving less during the day, and less movement affects your circulation, your metabolism, and your overall health in ways that can further impact your nighttime sleep quality. Here are my golden rules for napping if you're over 60. First, keep it short, 20 to 30 minutes maximum. Second, nap earlier in the afternoon, ideally before 2 p.m. And third, make sure your nighttime sleep is sufficient. You should be aiming for 7 to 8 hours during the night. Let me share Linda's story. She's 69 years old and used to take 90-minute naps after lunch every day. The result? She couldn't fall asleep until 2 a.m. When I asked her to cut her naps down to just 25 minutes, within 1 week she was falling asleep at 10 p.m. and waking up refreshed. Short naps equal deep night sleep. That's the formula. Now, here's a tip that many doctors forget to tell their patients. The medication you're taking every single day might be the culprit keeping you awake at 3 a.m. This is something I check with every new patient, and you'd be surprised how often we find the problem hiding in plain sight. Let me walk you through some common medications that can disrupt sleep. Beta blockers, which many seniors take for blood pressure, can sometimes cause nightmares or mild difficulty falling asleep. Corticosteroids like prednisone, often prescribed for conditions that cause discomfort, can make you feel jittery and anxious, making it harder to wind down. Diuretics, or water pills, increase nighttime urination, which of course disrupts your sleep multiple times. And certain antidepressants may have stimulating effects that interfere with sleep if taken at the wrong time of day. But it's not just prescription medications. Supplements can cause problems too, especially if you're mixing them with your medications. Taking B-complex vitamins in the evening can leave you feeling too alert. Supplements like ginseng or rhodiola are natural stimulants. Some pain relievers contain caffeine that you might not even know about. And there can be interactions between medications and supplements that your body doesn't handle well. Here's what I want you to do. First, make a complete list of everything you're currently taking, including over-the-counter medications and all supplements. Second, schedule a medication review with your doctor or pharmacist to check dosages and timing. Sometimes just shifting when you take something can make all the difference. Third, ask about alternative medications if your current ones are causing sleep challenges. And fourth, keep a simple sleep diary when you make any changes so you can track whether things are improving. Let me tell you about Thomas, who's 73. He was taking blood pressure medication in the evening and complained about constant nightmares. After I discussed this with his cardiologist, they switched him to a different medication, and the nightmares completely disappeared within a week. Don't change your medications on your own, but absolutely ask questions and advocate for your sleep health with your medical team. If you found this helpful, please share this video with your loved ones who might be experiencing similar challenges. And now, here's the final tip. And this is the most important one that 80% of my patients have been missing. I can't tell you how many patients I've seen who've spent thousands of dollars on an expensive mattress but are sleeping on a 5-year-old pillow that's completely flat. It sounds simple, but let me tell you why your pillow might be even more important than your mattress, especially as we age. A quality pillow is crucial for seniors because it provides proper neck and spine alignment, reduces shoulder, neck, and back pain, prevents numbness in your arms and hands, and supports better breathing throughout the night. When your neck isn't properly supported, it can lead to all kinds of problems that affect not just your sleep, but your daily activities. Here are the signs you need to replace your pillow. If you've been using it for more than 2 or 3 years, if it's lost its lift and feels flat, if you're stacking 2 or 3 pillows to get enough support, if you frequently wake up with neck pain, or if your pillow has stains or an unpleasant odor, it's time for a new one. So what should you look for? I recommend an adjustable shredded memory foam pillow. Here's why these work so well. You can customize the height by removing or adding fill. If you're a back sleeper, remove some of the fill to create a medium loft. If you're a side sleeper, keep it fuller or even add more to maintain proper alignment. Invest at least $50 to $80 for good quality. This isn't the place to cut corners. My advice is to choose brands that offer a 30 to 90 night trial period. This is so important because you need time to know if a pillow truly works for you. Read reviews from people in your age group and avoid pillows that are either too firm or too soft. You want something that supports without creating pressure points. Susan's story really illustrates this. She's a 66-year-old retired nurse who suffered from chronic neck pain. I discovered her pillow was 7 years old. After switching to an adjustable memory foam pillow, within just 2 weeks her pain decreased by 80% and she was sleeping much more deeply. A good pillow is the best investment you can make for your sleep, and it only costs about the same as a few meals out. Now let me wrap this up with what matters most. So we've covered 7 sleep tips that nobody usually tells you. Relaxing your eyes with the palming exercise, using warm eye compresses, keeping your feet warm, adjusting to the right sleep position, napping short and at the right time, reviewing your medications, and most importantly, investing in a quality pillow. The wonderful thing is that all of these tips are easy to implement and you can start tonight. No medications needed, it won't cost you much money, just a little attention to these small habits that can make a big difference. But if you're still waking up in the middle of the night and don't know how to fall back asleep, my next video will share exactly what you need to do when you wake up at 2 or 3 a.m., including the common mistakes most people make that actually make things worse. That video will be out in the next few days. Now, I want to hear from you. Which of these 7 tips will you try first? Leave a comment below. And if this video was helpful, don't forget to hit like, share it with your loved ones, and subscribe to the channel so you don't miss future tips. Thank you for watching, and I wish you a wonderful night's sleep tonight.